morning. My name is Lisa Bloor, and I'm going to do a presentation for you. I know we've already met, but I'll just give you a little background. I'm from Gonzaga University, and I'm doing online teaching. And this is my practicum hours. Today we're going to talk about APGAR score for newborns. I gave you a handout. You have this one, which we'll get to, and this kind of gives you an idea of what the scoring system is. And then I gave you an evaluation that you can fill out at the end, so please be very honest with that. So does anybody know what APGAR is? Do you know why we do the APGAR score? Have you seen APGAR performed on any of the newborns? APGAR is a quick test performed on a baby at 1 and 5 minutes after birth. The 1 minute score determines how well the baby tolerated the birthing process, and then the 5 minute score tells the doctor how well the baby's adjusting to external life. So usually in a report you'll hear an APGAR of maybe 8-9 or 7-9. Usually the second score is a little better than the first one. Just a little bit of history about APGAR. I thought this was interesting. APGAR was developed by a lady named Virginia APGAR, and it was in 1952. Virginia was one of Columbia University's first female doctors. She was one of the first American women to specialize in surgery. She specialized in anesthesia and childbirth at a time when fetal monitors were not yet invented and babies were given little attention after birth. Dr. APGAR began to question how best to evaluate the newborn infant to improve health and survival rates. She created a simple but effective 5-point scoring method designed to focus attention on the newborn's vital signs. And we'll get to what those vital signs are here. APGAR stands for appearance, pulse rate, grimace, activity, and respirations. So this kind of breaks it down. The score it goes between 0 and 2. So first, and Ruth Ann was talking about this too, when a nurse sees a newborn baby delivered, she doesn't really go through this and say, okay, what color is the baby? And she does a very quick assessment. So usually she's picking out the abnormals. So when you see the baby come out, if you see it's all pink, that's a normal sign. So what you would notice is if the baby was all blue or if maybe just the extremities were blue. So you can see there if the baby's pale or blue, the baby gets a 0. Pink body, blue extremities scores a 1. Pink, completely pink scores 2. Then you look at the pulse rate. If there is no pulse, you get a 0. And this is another quick assessment. You just use your stethoscope, you listen to the baby's heart rate, and you count. Do you know how many seconds you count for? 15. You're doing a real quick assessment, so count for 6 seconds. And then say you count for 6 seconds and you get a score of, you get 10. You get 10 beats in that 6 seconds. Add a 0 to it, and then you know the heart rate's 100. So that's a quick assessment with your stethoscope. Just count for 6 seconds, add a 0 to it, and you know what your heart rate is. Respirations are a little different. Do you know what normal infant respirations should be?
35, 30, 50?
I have like 30 to 60. Is that about what you're telling? So same thing. You're really not going to sit and count those respirations. You're going to look more for, is the baby crying? Does it have a good cry? Is it kind of a weak cry and shallow respirations? And we'll go through a few scenarios, and it'll give you different ideas of what you can decide on the respirations. Now you can count your respirations, and say you have respirations of 20, you know that the baby isn't breathing as well as it should be. The next one is grimace. I added irritability to this because sometimes grimace is a weird, a word that sometimes you might see something different, like reflex or irritability. It's a term describing the response to stimulation, like a mild pinch, or sometimes we stimulate the baby by just drying the baby off, or you still tap the bottoms of their feet, just kind of some kind of stimulation, and it makes the baby kind of mad. So that's the grimace. If it's just kind of a mild, like not a lot of reaction, you might want to give them a 1. But if there's a vigorous cry and they're just mad, you give them a 2. Then the last term that we use It's another one you might see different things. It's the activity or the muscle tone of the baby. And that's like, is the baby all flexed up or is it just laying limp? And you can see on your handout, kind of give you a picture of what you might be looking for there. You never just see a baby just laying around and that being normal. So the baby's all flexed up, that's in a nice strong cry, you know that they're getting a 2 for that. And there's the copy of what we just went through. So some normal results. The APGAR is based on a total score of 1 to 10. 10 is the best number you can get because it's 5 things that we're rating 0 to 2. The higher the score, the better the baby is doing after birth. A score 7, 8, or 9 is still normal, and it's a sign that they're in good health. And usually, you're rarely going to see a score of 10. Occasionally, you do see one, but for the most part, a baby is going to have some cyanosis of the extremities. So that just says there. 10 is very unusual. Almost all babies lose at least 1 point for that. So then if we look at some abnormal things, below 7 means that the baby probably needs some kind of attention. The score, some things that could make the score low, maybe difficult delivery, maybe sometimes C-section babies. They have a lot of fluid. You might get a lower score. So some strategies to assist them. Give them oxygen. Sometimes have you heard of blow-by oxygen, where you just kind of lay the mask beside them and they get some oxygen that way. Physical stimulation, like we talked about, drying them off, tapping the bottoms of their feet. Sometimes that makes them cry, and that clears some of the fluid. Also, that stimulation gets their heart beating a little faster. Most of the time, a low score at 1 minute is near normal by 5 minutes. So we're going to look at a few examples. We'll go through them, and you can use your chart to kind of score, and you guys tell me what you think. Okay, the first one here, you're assessing the infant at 1 minute. She is pink all over, has a pulse of 130, and as you dry her off, she begins to cry vigorously, kick her legs. What do you think her score would be? 10? All right, she's doing everything is normal on her, so that's a good baby. That's somebody you're probably not going to see that often, but it does happen. All right, it's been 5 minutes. The newborn has a strong cry and is actively moving his blue extremities when stimulated. Vital signs are pulse 140, heart rate of 48. What do you think this APGAR score is?
9.
Yeah, pink with blue extremities, so we're going to take 1 off for that. No, that seems pretty okay. So what are we all agreeing on? A 9? Okay, here's one. It's been 1 minute since your patient delivered her baby. The infant's crying weakly and is curling its arms and legs. He's pink all over with a pulse of 90 and weak respirations. So what are we going to take off for?
Pulse.
We're going to take 1 off for the pulse,
Respiration.
1 off for the respirations. Okay, so what do you think this score should be? 6. And let's go back there. Is it pink all over? Yeah, it says pink all over. Okay, I wondered, we have 2 there. That seems a little unusual, pink all over with a heart rate of 90. But we took 1 off for the pulse, 1 off for the grimacing, and then the activity and respirations. So that baby there, we probably would have gave a little assistance to. Just give it some stimulation and some oxygen. Okay, after assisting in the delivery of a newborn, the infant is pale and limp and has a slow heartbeat, which shows some respiratory effort. What APGAR score would you give this infant?
2.
It's not doing very good. So what do you think is going to happen with this baby? It's probably going to start some resuscitation efforts for it. Usually, when they first come out, there are 2, get some interventions and hopefully get a better response. This is the last one, I think. 1 minute after birth, your newborn patient is actively crying in response to your bulb syringe. You know what your blue bulb syringe is, right? That's like one of our most important things that we keep with us. His body is pink and he is moving his extremities, which are blue. His heart rate is 110. What is this newborn's APGAR? Yep, that's a 9, yep. All right. So you guys feel like you have a pretty good grasp on what that would be? All right, good. We're just going to recap everything. The most important things I think that you should take from this lecture is just that the APGAR is a quick assessment, and you're looking at the baby at 1 minute and 5 minutes. The APGAR looks at your appearance, pulse, grimace, activity, and respirations. And I think that's about it. Does anybody have any questions? No? Okay. Thank you very much. And just make sure you fill out my evaluation.
No.